really want doctors to be thinking about, better quality care instead of quantity. We had one woman say to us, like, healthcare feels like you're going down the cafeteria line in high school and like you get slopped healthcare on from one person, they tell you to move on and they slop more healthcare on, and like you don't really have a say. You have to just like keep going down. And we thought, what a great analogy for our fee-for-service healthcare system. It really is just treating you as like the person down the assembly line. And then when we talk to people, they're like, okay, well, there is a movement to do this sort of healthcare differently. We need to center patients more on it, but it's called value-based care. Like, what do you think about that, people? And it was the worst performing messages we've ever had. That
was going to be my question. I was like, does value mean value as in like I'm getting more services for cheaper, and then cheap means bad in my mind? Like, what does that mean? What is value? All right, guys, welcome back to a brand new episode of the Hart and Hustle Podcast. Now, I'm incredibly excited because I have another amazing guest sitting across this digital table with me. I have Natalie Davis, who is the CEO of United States of Care. Natalie, welcome to the show.
Thank you so much. I'm so glad to be here.
So Natalie, we like to kind of get these things started. We're going to learn a lot about your Hart and Hustle today, specifically in the work that you've been doing. I want to tell everybody about kind of what I said before we started getting going here today is the hand-to-hand combat in interviewing people about their preferences and what it means to truly meet them where they are in their healthcare journey. So you said that you guys have done over 25,000 interviews across different demographics, asking patients what they want out of healthcare. That equates to over 5,000 hours of time spent with people, hearing it from their mouth.
Yeah.
Why did you guys choose to take that specific approach to learning what people want in healthcare?
Yeah, it's one of my favorite parts of the organization. It's what definitely sets us apart and is our unique value add to improving our healthcare system. When we started this organization about 7 years ago, we wanted to prove a theory that we had coming out of when I was working in the Obama administration on healthcare.gov and other issues, that if you got away from the politics of healthcare, people actually agree on more than they disagree of what they want out of the healthcare system, what they want their experience to be. So we had this theory, and then we had to prove it. And so building out that strategy to really go out and talk to people about their healthcare experiences. What do they love? What do they hate? What makes them angry? What language do they use? Where would they want to see targeted changes? Do they want a big blow up to the system? Do they want targeted changes? We really wanted to go out and authentically listen is what we say. And so there's a lot of work that's done in politics and in an advertisement where you have an idea, you go out there, you put it in front of people, and you kind of know they're going to like it, or you're going to get some good stats on it, some good polling results. But we call that lipstick on a pig. And we definitely have used that sort of approach before when we're really close to passing legislation over a line and you really want to get the numbers to show people support this. But that's not what we wanted to do as the basis of our organization. We want to go out and listen to people. And so years ago, we started out by talking to people and just asking the same 5 questions. What's the first word you think about when you think about healthcare? I wished healthcare worked more like blank. We had a couple of those questions, and I brought those to kitchen tables in San Diego, to a Red Hot and Blue in Texas, to the Love Park in Philadelphia, and to really understand, okay, if we didn't lead people to the answer, what would we hear? And that work has continued. Like you said, we've engaged 25,000 people, every single state, 5,000 hours, and are building what I call the mapping the human experience of the healthcare system. And then we use that to drive change. It's not just so we can understand people, but it's so we can go out and advocate for policy change that we can talk more about. We can center people's needs in a conversation that often just feels like it's about the healthcare system and not people. We can change that kind of narrative. We can build policy recommendations that others can run with and make happen. But for us, we didn't feel like there was an advocacy organization that's just for the people and just there for healthcare and making sure healthcare can change. So I'm glad you started out with that. It's something we're super proud of. We hope to, increase our data by 50% every year and really continue to get a pulse of the people, as we call it.
When I sit across this table with amazing people who are having such a gigantic impact, I have to ask myself the question, was this the plan from the very beginning? Like when we're in fifth grade, our teachers ask us, what do you want to be when you grow up? And we say an astronaut or a firefighter or a professional baseball player. But did you always say that this was going to be my path early, or did that change along the way?
I have you met people that have been on the path that they started in fifth grade? And
I've met a couple, and that is an anomaly, right?
okay,
That's the
I
path
was
that
gonna
we all
say,
think, but everybody else says, I did everything and I was brought to this moment, which made so much sense.
yeah, I think no, this is not. I came to Washington, D.C. actually to be a museum curator. So even if we're going back like 2 decades, I didn't come to D.C. to work on health policy. I came to really understand the intersection of society and individuals. How do they interact and how does that show up in art? And came here and realized that nobody leaves the amazing museum jobs in D.C. and I needed a different path. And thankfully, a lot of my interests were in healthcare. But I say, looking back, and I've had a coach that's helped me realize recently, like what has been the theme of what I've been interested in, what I've been paid to do, what I do on my own free time, what people praise me for. And, solving problems, breaking down things and questioning things and then building solutions. And I've come to learn that that's kind of the definition of an entrepreneur. I never felt worthy of what I think is like one of the coolest things, which is being an entrepreneur, but it really has been something that that has stayed with me, I think, since early on. I just didn't have necessarily a topic. When we came to DC, my husband and I started, while I was doing policy work in DC on healthcare, I started a flower company because I realized that I wanted to do my own wedding flowers, and I found a wholesaler, and then I started doing other friends' weddings, and one was featured in Essence magazine. It was a beautiful wedding, and then started doing table flowers for fundraisers here in DC. And so it was a really fun way before I had kids and had time to kind of scratch that entrepreneurial itch. And then, of course, starting a nonprofit. I'm one of the co-founders of this organization, and I think that's been the through line. Even working in the government, we don't think of that as entrepreneurial necessarily, but there's been really hard problems and coming up with new ideas on how to do so. And working on healthcare.gov, I think there was nothing more entrepreneurial in the moment of creating a brand new way people can enroll in insurance, and doing it through such an amazing platform like the federal government.
So we've talked about a lot of stuff, right? We're a museum curator. Then we recognize we're going to be an entrepreneur. So we start taking on different ventures, but then the big elephant in the room becomes healthcare, right? So why so many people choose to stick away from this space specifically because of how slow this ship turns to make changes that people actually want. So how did you think about approaching this challenge a little bit differently through the lens of saying, okay, if I invest my energy and time into solving this problem, we're actually going to get a substantial result out of my effort and time?
Yeah, it's a good question. I haven't thought about an answer so specifically to that question. Healthcare is the basis. Health is the basis of like literally our lives and our bodies, and anything we want to do with these lives and bodies, whether that is through friendships, through romantic relationships, through work, through fun, and the idea that something like that could hold you back from living a life, however that may show up in the body that you have. I think to me, it felt like such an important, almost no duh issue to work on. And, I think there are times where it's important that healthcare and other huge industries that impact our lives do move slowly. I think, there's times where it's good that policy and Congress and the administration and states can move slowly to make sure we're not having huge disruptions to healthcare. And then I think, what I wanted to do and what a lot of us wanted to do with building this organization was say, there are times we need to move faster or we need to move slower, but either way, we need to be centering the conversation on the people that matter most, which are us patients, these people, these humans with bodies that need to live the best lives that we can. And so I think my foray into healthcare, especially if we look at healthcare.gov, that felt very fast. That was a huge innovation that was changing healthcare very quickly. It's enrolled millions and millions and millions of people in a brand new program and brand new way. And I look for those kind of entrepreneurial moments in a lot of the policy work that we do, knowing that it does take time to craft and advocate and pass new legislation, but but sometimes that's done so we can make sure we get it right. But let's just the way we do healthcare. We should be doing an entrepreneurial way, more of a human-centered policy approach to change.
So there's a famous saying. It says, the person who has their health has 1,000 problems, right? The things that we want in life, can't get the new car, I've got a leaky faucet, things like that. But a person who doesn't have their health only has one problem, and that's getting their health back in line.
Yeah.
So what are some of the perspectives about what you learned in this journey, if you will, on the perception of healthcare? And then what do people actually want? Are there core pillars that we find that are commonalities on all the people you've spoken to?
Yeah, it's a great question. So there are some core kind of things that we've learned as we've kind of mapped out the human experience in healthcare. And one is that affordability, being able to afford your healthcare, is the most important thing for people. It wakes them up in the middle of the night. It decides if they're going to go to an appointment or not. If you talk to people, even if the entry conversation is about maternal health, if it's about mental health, it's about anything, almost the first thing people say is, yeah, but if I always worry I can't afford it. I lost my job during a public health emergency, and I don't have insurance, so I can't afford healthcare during a public health emergency. And so affordability is the number one issue that we hear from people. That's why it's the number one issue that we work on in states and Congress across the country to make sure that we can make it more affordable for people. Some of the other nuances that we hear are that people really have come to not trust the healthcare system because they don't believe that their needs are at the center. There's a real skepticism that other people are making money off of your back and you have to carry all the weight. There's a real skepticism that I don't feel like my doctor is always able to spend enough time with me. Their back is to me, or I don't know, maybe they're getting money from this pharma company to prescribe me something and they're not actually first listening to my healthcare needs and prescribing lifestyle changes or other ways that I can be healthy. And so there's kind of this distrust of the system itself. I think we've seen some of that play out over the last month or so with the murder of the United CEO. And while that should never be the case, I think many people believe, it was a cultural moment, and the cultural reaction is something we can't ignore, which is that people really feel like, this is another finding, that they're going at this alone. The healthcare system is not meant for them. They have to figure it out on their own. Maybe they're too dumb or too smart or too sick or too healthy to pick the right insurance plan, to make the appointments they need to make, to follow up, to coordinate their own care. I mean, this is too much. And people kind of feel like they know the system's not there for them, but they also feel like a personal failure. And one of our goals of the organization is to show that there are things people agree on, and these are collective kind of concerns and needs, and that's where we can center our efforts. And so at the very beginning in our kind of core research, after really hearing some themes from people, we went back and said, okay, we're going to find these shared values. What is a value framework where people can say they agree on these things need to be changed? And there are 4 things that people want out of a healthcare system that works for them. Number 1 is they can afford their healthcare. So it gets back to the affordability issue. Number 2 is people want dependable coverage as their life changes. And that means that their insurance is there if they get cancer, if they have a baby, if they lose their job during a pandemic. People don't feel like it is right now. And the idea of coverage being there for you really resonates with people. Number 3 is people want personalized care. And for them, that means getting healthcare that meets their own needs for their own body, their full body, not just an elbow versus their mental health, in a place where they want it. So is at school, in the community, et cetera, virtually. And then lastly, and this is one that people usually laugh at, is people want a healthcare system that's easy to understand and navigate. Enough said on how people feel with that one. And we brought back those 4 goals back to the public, brought 75 different policy solutions and said, force rank these, talk to us about these. And there are 12 that kind of nest under those 4 values that look like anything from reducing the cost of prescription drugs to increasing support for people that get insurance out of not from their employees, to better maternal health, better mental health, more care in the community and virtually. Maybe this idea of like a care navigator that will come with you to an appointment. There was one woman who's a wheelchair user, and she was like, if my family members can't come to an appointment with me, I have to rely on a tech to lift me up for my mammogram. And that's not comfortable. I don't feel secure. Can I have someone that comes with me from the healthcare system that knows me and can help listen to the results, help me navigate it? So these aren't like radical ideas. We really see them as a place to center where we drive change, whether you're an entrepreneur, whether you are a policymaker, an advocate. These are what we heard from people across demographics, politically, race, ethnicity, income, that they really want fixed.
Were you surprised by hearing these four kind of pillars emerge, right? We talk about affordability, we talk about dependability, we talk about personalized, and we talk about easy to understand. Based on kind of your outsider's perspective in healthcare, did you have some of these same qualms, I guess, with the overall healthcare system, that maybe you didn't understand healthcare? Maybe you felt that it wasn't affordable or dependable when you were going into this process of surveying so many people?
Oh gosh, I mean, I definitely feel that as a patient and as a mother and as a daughter. My son, just last weekend, we had to go to the ER because he was in diabetic ketoacidosis. And we just learned at that moment he has type 1 diabetes. And so all of a sudden we're, a whole new world of healthcare is opening up to us. And that's from the ER bill to the amazing techs that are helping us with the technology that he has. So when we first were starting this, we were a startup organization, a nonprofit, and we were trying to figure out our own insurance and how we were going to take care of our employees. When I started at the Obama administration, my husband and I were both working the same son. He was born months prematurely and was in the NICU for a month. And we chose who was going to become the stay-at-home parent because my job had insurance through the government. And so, you kind of, totally as an individual, you try to navigate this as best you can with the information you can. And it's kind of unbelievable to me how much you have to be your own self-advocate to make it through all four of those goals. It really does at times feel like the system isn't there to help you. So I'm trying to remember if any of these surprised me. I think I was just so excited.
Yeah, to be getting this information.
Yeah.
Man, I mean, I just think about the element of trust, right? If you come to somebody in a moment of insecurity, of doubt, right, you need to lean into a trusted resource. And I wonder why so many people don't trust the healthcare system. And I want to kind of reverse to the points that we were making.
Yeah.
I mean, every single year we hear more and more people, unfortunately, having a difficult time navigating the healthcare system.
Yeah.
Yet the optics of healthcare in general is, Optum puts up record profit numbers this year. And it seems like there's a disconnect from the messaging that we see in the media compared to the personal human-centric experience that other people understand. Where do you think this started, right? That separation between the human and the organizational optics of kind of what healthcare is supposed to mean?
Oh, it's such a great question.
Because this was not the world that our grandparents grew up in, right? This is also not the world that often our parents, I was born in 1990, came from, and like navigating these complex health environments and not having a trusted relationship with your doctor. It just seems like this has been coming over the last couple generations and times and, decades. Or when do you think this really kind of started?
Yeah, I think a couple of things. I think our population has ballooned into such a larger amount of people with more diverse needs. We're living longer. We are looking for more and more treatments, more and more ways to stay healthy longer. And that a lot of that comes with cost. If we're looking at the new, weight loss drugs, the Ozempic, et cetera. The federal government has a huge question in front of it. Is it going to pay for these drugs for people? And so I think it kind of became intrinsically interconnected with the cost that it costs the government, the cost that it costs insurers or hospitals to maintain. And I think it also became a really attractive place to build companies that you hope could make a lot of money. I think it's, if you go to some of these huge healthcare conferences where people are creating new apps and new companies, and I don't think there's necessarily anything wrong with that. I think it just has become very, very flooded with ideas. And for the most part, most people are looking to make money off of those ideas. And I think it just got quite mixed up when we put together the demographic changes, the desire and need for new innovations to stay healthier longer, and this kind of view where you could see healthcare as a place to make profit.
I have a simple question about time. Now, this is a really interesting one because, based on the data and the research and the conversations that I have, I hear that on average, your doctor spends about 5 minutes with you in the actual care environment, right? If we're talking about like a checkup, a primary care visit, that same doctor spends about 15 minutes documenting that interaction because it's vital for them to be reimbursed for the service that they just delivered to you. Patient interaction, 5 minutes, documentation, 15 minutes. If you change the incentive, you would change the outcome of that interaction. So why do you feel like doctors are being held captive, I guess, with golden handcuffs to say, I have to document for 15 minutes, which equates to me being on my computer asking Natalie, so that's still consistent with you? Okay, sounds good. Like, where do you think we can kind of switch up that, I would say, consumer-centric experience? Because it seems so opposite to everything else that we experience in our daily lives.
Yeah, I think that's right. And it's what's interesting is, so there's a concept of what's called value-based care in healthcare, and how and that has been a bipartisan issue across administrations, from Obama, others that were thinking about this beforehand, through Biden, through Trump, and on the Hill and in states. And it really is looking at how do we change the incentives so providers are giving the best quality care and with the best outcomes to people. And it has there has been a lot of changes as we think about that sort of movement to more accountable health. It has also come with a lot of reporting requirements, a lot of like a doctor can prove they're doing well by filling everything out in an EMR. We have EMRs that are locked down, which can't be shared among others. And patients are responsible, whether they say so or not. We're still responsible for bringing that information, even if it's just in our head, from doctor to doctor. Our organization has kind of realized that the way we have talked about this concept of value-based care, the way we've constructed the policy, really has been about provider incentives and provider reporting to make sure that we're giving better outcomes. And there is definitely some goodness there, and there's definitely too much there. We've felt like we've missed, and when we talk to people across the country, is like, okay, but if you're going to build this better healthcare system with different incentives, how would you do that around the patient? And what matters most to the patient in that? And the number one thing that we heard from people is time. They want more time with their doctor. If we are going to incentivize doctors to care and give good outcomes, patients want more time. They want to be seen as a whole body, and not just, like I said, their elbow or their knee surgery, but like, how is their mental health impacting their back pain, and how can they then go out and get PT instead of maybe back surgery? And so this idea of more holistic kind of whole health, full body, and they really want doctors to be thinking about, better quality care instead of quantity. We had one woman say to us, like, healthcare feels like you're going down the cafeteria line in high school, and like you get schlopped healthcare on from one person, they tell you to move on, and they schlop more healthcare on, and like you don't really have a say. You have to just like keep going down. And we thought, what a great analogy for our fee-for-service healthcare system. That really is just treating you as like the person down the assembly line. And then when we talk to people, they're like, okay, well, there is a movement to do this sort of healthcare differently. We need to center patients more on it, but it's called value-based care. Like, what do you think about that, people? And it was the worst performing messages we've ever had. That
was going to be my question. I was like, does value mean value as in like I'm getting more services for cheaper, and then cheap means bad in my mind? Like, yes. What does that mean? What is value?
It means exactly that. One woman was like, I don't buy value bacon. I don't want value healthcare.
Exactly.
Yeah. But we've been talking about value-based care for decades, and a way to sit, and they're like, and what does value even mean? And who's deciding the value? I want to decide the value for my health. And so we have companies out there that are doing value-based kidney care. And it's like, I think people think you're getting a cheap kidney. Like, I don't know. This
Walmart version of kidney care.
Yeah, exactly. And so we said, okay, well, what would you call this? And it was patient first care. They want to be at the center. And even the idea of incentives actually really piss people off. They're like, why do you have to pay a doctor extra to give me better care? Like, isn't that their job? Isn't that why they go to school? And so, money really is tied up in so much of healthcare. And in some ways, policymakers, we've done it to ourselves by calling it something like value-based care, by focusing on incentives, by talking about the cost curve and the Medicare trust fund, all important stuff. But in the meanwhile, people really feel like none of that conversation has to do with the health that they need, the healthcare
Right.
they need.
It sounds like messaging has been targeted at those who are providing the healthcare services rather than the recipients of it. And that just seems completely opposite of consumer-centric care today, or
Yeah.
just consumer-centric world that we live in general.
That's right. And we're not here just for like good messaging, exactly, but the good substance underneath it. And so like if you go to our website, you can see that work on patient first care, as we call it. And not only do we talk about like the frame of patient first care and what matters to people most, but the policy principles that should stand up behind that. And so if we're building patient first policy principles for changing our healthcare system, this is what that would look like. And that's all to the end of making sure that we're paving a path for policy to change. Like if we're doing good message testing, it's so good policy passes, good laws pass. And that's kind of the recipe that we work on, and then we go out and pass them.
Mm-hmm. Well, here's a recipe for, let's say, creating a more personalized, healthcare experience. One of the biggest challenges if you're integrated into healthcare in any fathom or any factor is you're recognizing that we have huge staffing issues, nursing shortages, doctors, certifications of docs who are coming out of medical school. That number continues to decline. So is there a way for us to start thinking about the other human that we're kind of all developing today in the world of like AI? Is there a synergy or a collection between using digital team members to gather information for us that makes it readily available to enable the patient to go into the healthcare environment better prepared and feel more personalized? What's kind of your 2 cents on AI in the healthcare space?
Yeah, I mean, it is definitely everywhere, right? And I think if you're in the AI healthcare conversation, you're realizing where we're calling what was just like digital health or other things like AI, but then there are real advances happening in healthcare. And our goal, actually this past summer, was to go out and talk to the public about like, do they know AI is coming to healthcare? What does that mean talk about trust? What does that mean for their trusted relationship with the healthcare system or their provider, more likely? What scares them? What interests them? And then what changes across demographics? And we'd say there are some people that self-reported, at least, that they do know that AI is in healthcare. And often they knew that from watching the news. That was the biggest source they had of kind of understanding AI in healthcare. The more people knew about AI or self-reported knew about AI, we saw a correlation of their comfort of AI being in healthcare. But then we went with 5 use cases that we're kind of seeing out in the marketplace right now. Anything from back office to support ambient listening to actually support during like a surgery. And it became clear, and it was really wild. It was across demographics, almost the exact same. Like it was very, very, very little demographic difference. People, where they had comfort, it was usually like in back office admin sort of support. And then the closer it got to their own care, the more nervous they got for it. And what that tells me is the healthcare system has a long, long way to go of building trust with people with AI. And we've seen over and over again that we wait too long to let people know about innovation that's happening in healthcare, and all of a sudden we just plop it in there and we expect them to be fine with it. And my real concern is that we aren't taking the time as a healthcare system to really understand what are the use cases people care most about, and how do we bring them along on this journey so that when we are asking people to, do an AI diagnostic before they show up, and or ambient listening, that we're doing that hard work. I think Deloitte had a survey out asking health system executives their priorities right now in AI. And of the 5 they listed, every single one of them, I think, listed in educating consumers or patients on AI as the least important they have right now. And I think that's just a big mistake. I think
huge.
Yeah. And we're going to really take a step backward on progress that we could be seeing but we have to be taking the time. And interestingly, the one really interesting finding that we had with that, and we're seeking support to go out and do more listening towards these research questions. But one was, there were times in the survey that people, Black people and Hispanic people, actually had higher degrees of interest in healthcare in AI making healthcare delivery better for them. And we weren't able to ask why in this research study. So we're chomping at the bit to go out and do that. Our hypothesis is that people of color recognize that the healthcare system isn't meeting their needs. It definitely doesn't have their needs centered, and maybe AI would make that better. There's all sorts of questions we would ask under there of do people know about how algorithms are created and such? But maybe they do, and maybe they still feel like AI would be better than some of the ways they're treated the healthcare system right now.
I mean, naturally, I go from the place of thinking about stigma towards healthcare in different segments of our population and demographics, right? If you don't feel like, even from a position of being able to raise your hand and ask a question of a trusted resource is challenged because that's part of your culture, right? We don't talk about those things outside the house. Maybe this is a digital front door that people can access to get good, trusted information from a trusted resource that they can lean out to.
Yeah, absolutely. We just got to do the work to get there, right? I mean, we've been in rural counties, especially in South Carolina, but in Colorado and others, and there's a real lack of providers, like you said, and they aren't getting as good of care as everybody else. AI has virtual care in AI, and a real opportunity to really bridge some divides if we care about getting those into the right places. People talked about that they didn't feel like they could go in their little local town. They couldn't go to the addiction center, or they couldn't go to a mental health center because everybody would see them going. I mean, so they don't. And there's real ways that this could help. My worry is that we're just not focusing on patients, let alone those that are often left behind.
Yeah, I mean, it seems like once again, if we change the incentive, we change the outcome. Because I think about naturally, of course, and this is a big process for me. In 2014, I started a telehealth company, right? And so we were starting to go out and say, hey guys, doctors, CEO of the hospital system, there's going to be a future for a virtual interaction. The biggest instance that stopped our initiatives from moving forward was not that our patients aren't going to like this, but I'm never going to be able to get my docs to adopt this, which in itself seems a little bit backwards from how we need to kind of attack the future. We need to educate the population to make sure they're comfortable with this tool. And then when they come into an environment that they've been educated about, they understand how the technology directly impacts them and their overall journey in the healthcare system. Seems like just a natural.
And we've made it clear why this is important to them. Yeah, to the goals they have for their health and the healthcare system. I agree.
Man, so here's a question for you. I want to switch gears a little bit and talk about how we build a team around such an important initiative, right? So recognizing that being a museum curator, right, and starting your own flower shop, right?
I just wanted to be.
Okay. All right. Well, and then we pivot into saying, hey, I'm going to be a part of this organization. We start up a nonprofit. I ascend through the organization from an advisor to being a CEO. So how have you been able to cast a vision, right, as a leader of the organization to find other highly talented people to get behind this mission that you guys are actually kind of, pursuing?
Yeah, we have the best staff. We've had the best staff that have worked here since over time, and that are here now, and the people that have helped shape the organization. And I think one of my core tenets is really hiring. It's kind of, I know a lot of people say this, but hiring people that are smarter than you. I'm not a policy wonk, but I've hired the best policy people to do the policy wonk. I started our community engagement work, but I'm not a researcher. And so for me, making sure that we are hiring the best talent and they know that they are coming in there to build the strategy, and seeing how that all ladders up to the overall organization's mission is really critical. And really allowing people, as they've been here, is to build out what are those strategies for the work that they're doing. Our state team, it would be a disaster if I built the strategy for our state advocacy work. Our team that is out in states who have worked in the state advocacy space should be doing it. And so I think really building the team of experts and letting them run all towards our overall OKRs for the organization has been really key. And then something we've really been focusing on is then how do we retain that amazing staff? And for us, that means like great benefits. And as a nonprofit, we can't pay the best. People could go and get, better high paid jobs, but they're mission driven. And so making sure that we have unlimited vacation time, which we still have to force people to take. We close between Christmas and New Year's. We close on Fridays in the summer. We have a sabbatical plan that I took my sabbatical this past year. I was the 5th employee to take sabbatical, and really making sure that as we think about what is diversity, equity, inclusion, the idea of inclusion means to us, that people are showing up as the full self, whatever they feel comfortable showing at work, but they also have a life outside of work. And all of that is supported through our work. And, I think maybe as somebody who is kind of creative and more of the entrepreneur, letting the team build those things within their expertise is something I at least look to the team to do. And I believe they feel supported in doing that as well.
You ever have feelings of like insecurity or imposter syndrome, right? Yes. Trying to have such a huge impact in the space that you didn't naturally come from?
Yes. Oh my God, all the time. And it's actually interesting. I had a media coach a couple of years ago when I first stepped into this role. My board chair is very supportive of making sure that I was ready to do this. And part of that was being a media coach. And a lot of those insecurities came out because when you talk to the media, you have to be confident. You can't say, I think this or maybe that. Like, you have to say things definitively, and you have to come with a presence and have some charisma. The first time we were doing this was all virtual because it was during the pandemic, and she was like, all right, Natalie, we're going to pretend like you're starting this webinar, 5, 4, 3, 2, 1. And I went back, I froze, shoulders back, and just started saying my script. And she's like, what happened to you? Like, you're very fun. You move your hands a lot. Like, what happened? And I'm like, well, I thought I should be professional. And she's like, you have the wrong definition of professional. Like, that's changing now. And, that honestly was one of the first times that it's helped me kind of push through imposter syndrome of having someone coach me of showing up with confidence and building that then under, as you get wins under your belt and you realize what you can control and can't control and, getting the coaching that I need in lots of different ways from my team and from others, I think has really helped as much as possible with the imposter syndrome. And I'm trying to, as Lovey I.J. Jones says, not even think of that concept anymore, because it means you don't belong in the room that you are literally in. And so I'm trying to abolish even that concept for myself, but I totally feel it. Do you, Keenan? Do you have that?
When I first got into this space, right, in 2014, or I was 24 years old, so I'm a young guy going into these hospital systems, I would dress up with a suit and tie, button up, slacks, nice shoes, and things like that. Now I go into meetings, right, with the current type of fit that I have, because one thing that I heard from a mentor, it's, confidence does not come from shouting affirmations in the mirror, but having a stack of undeniable proof that you are who you say you are behind you. And if I were to lean on any element of your story, the 25,000 interviews, the 5,000 hours spent means you have the information advantage. So we're not just hypothesizing or talking about ideas in a vacuum, but rather you've got the information advantage about what the people want. And so being able to come into a conversation like this and articulate what people are looking for based on the conversations you've had, superpower.
Yeah, so thank you for saying that. I love that quote, and I thank you for saying that. And it's funny, when I started that part of the work out, people, including people in our organization, were like, "What the hell are you talking about? You're going to go and talk to people, and you think they're going to agree on stuff? Like what?" And I really was taking lessons from human-centered design and from other ways that you center the patient, person. But those were scary times. It was not only a new organization, but it was also this really new concept that nobody really understood what I was talking about. But now we do have the data, and we do have unique IP, and we have a database, and we've impacted the lives of millions and millions of people through the legislation work that we've done in states and in Congress. So
let's go.
Just
to say very simply. So I want to talk a little bit about what's the future going to look like? What are we thinking about 2025, 2026? What are some of the initiatives? What are we trying to accomplish? What are we trying to impact?
Yeah. So we're going to out there talking to people, combing our data that we already have to make sure that we're continuing to find insights, and talking to people across the country. We're launching an initiative called Pulse of the People, which really is there to routinize our data collection, our conversations with people, make a public use website where people can find these insights on their own, and use that to drive a narrative in the next 2 years, 4 years, 6 years about what matters most to people. As I think about an election that's 2 years away, and then a presidential election that's 4 years away, I want to make sure that we are having a conversation across both political parties of what do people actually want and what are solutions to get us there. And I don't think either side right now really have the ideas that are going to meet the needs of people and the expectations that people have as we're coming up on elections. I know we haven't even inaugurated our new president, so I know I'm looking already towards the next election. But that's important in future planning. There's a lot of work that this administration and Congress wants to do to make healthcare more affordable in some ways, and we're here for that. We've done a lot of that work in the state level, and we want to bring that up to the federal level and show where we can make an impact to make healthcare more affordable. We also have concerns about a lot of ways that we're worried healthcare could go backwards and people will lose coverage and lose affordability. And so we're going to be working closely on that. Really defending people's access to affordability and making sure we don't go backwards. I think there's a real interest in this administration on what does health and prevention and wellness look like, and we want to bring that science-backed, responsible way of thinking about health, matched with what we hear from people, and making sure that view is represented. And then we are working in, we're hoping to work in states to really expand, and through our Women's Health Project, expand the benefits that women need after they are no longer pregnant. As we've talked to women, and I have 4 kids, I felt the same way. After you have the baby or you aren't pregnant, you aren't the one that people are catching up on, and your insurance isn't there to give you the support you need that year postpartum. And so a lot of work that we're doing in states to make sure healthcare is more affordable includes making sure women have what they need after they are no longer pregnant. So we've got a lot of work to do. Really excited to come and talk to you about that, to really talk about the amazing work our team does, and all towards making that more patient-centered healthcare system.
Well, knowing that we have leaders like you that take their heart and their hustle so seriously to be able to impact everybody, right, is so important. And I feel so much better knowing that we have amazing leaders and organizations like United States of Care out there that are prioritizing these things. So important. Natalie, we have a tradition here on the podcast where our previous guest wanted to ask you a blind question.
Oh, gosh.
So their question was, what does innovation mean to you?
I love that. Innovation to me means finding a problem to solve, constantly asking questions on why things are the way they are, how things can get better, not assuming any answer or way we've done it before matters, and then delivering that as a solution that you iterate over time.
I love that. Well, Natalie, it's easy to understand why you are on the show. You are the definition of heart and hustle. And I just want to thank you for everybody who's been tuning in, watching, and listening today. Thank you so much for coming on the show with us. We really appreciate it.
I loved it. Thank you so much.
All right, that's a wrap.